Maybe not.
No.
Okay.
Can you hear me now?
We'll find out real soon.
Yeah. I've never seen evidence to support the idea that you need to have excess monitoring just simply because of BMI. Like if there's other things going on, yes. So cholestasis of pregnancy, sure. If you have, elevated blood pressure, sure. If you have gestational diabetes, you're on insulin, sure. So if there's consequences or complications or sequelae of your BMI in the pregnancy, absolutely. But otherwise, no, not really. Art is literally, this show has gone out of control. He's on the ground trying to stay out of the camera view. I just missed one on TikTok. How many days after transfer do you get your first ultrasound? What should you see? So we wouldn't do it till about 4 weeks, and at that point you should see a sac and a baby. Does it make sense to check ureaplasma and mycoplasma for a healthy couple with unexplained infertility? Absolutely, it makes sense. It makes great sense to do that. So we would absolutely advocate for that. It's a completely reasonable choice and should be considered. I don't have high blood pressure or gestational diabetes or ICP this time. I did fail my 1 hour. Yeah, I mean, if you failed your 1 hour, you did they do a 2 hour? So, I mean, I would need to know how you know you don't have gestational diabetes, but overall, we would want to make sure that there's no sequelae, like I said. Questions?
Of course.
T is back in the house. Big round of applause for T coming back.
Great to be back. Great to be here. Let's begin.
I missed you, buddy. It wasn't the same without you.
You know what? My whole life wasn't the same.
Yeah, your friend was great, but it wasn't the same.
Well,
Plus, I had to run the whole show myself.
I heard.
Although I did get through every single question. Yeah, I don't think the show was as big without you, but we did get through.
Well, you had half the medical team here.
All right.
Hi, Dr. Victory. Yeah. How can I have a monitoring appointment this Sunday or Monday at your clinic as there is not us tech at the clinic during the long weekend?
Ultrasound tech. Yeah, I just do the monitoring on the weekends.
Easy peasy.
Saturday we have someone. Sunday, Monday, it's usually me unless it's super busy and we bring someone else.
Fellow gentlemen, when would one typically start estrogen to thicken the lining? My RE mentioned to use it after triggering. Would it be key to use it before for implantation success?
Well, we try to avoid estrogen use, so we don't use it very often. If we do use it, we normally start it before the frozen embryo transfer, but we try to avoid it if we can. And if we do use it, we use the absolute lowest dose that we can.
I think it's important that since we have reunited, that there should be a lot of likes and comments and shares of the show.
Yes, definitely.
You know what I mean?
Everybody, lots of likes for Tarek being back. Are you looking at the questions on TikTok?
Yeah.
All right, you're after.
I'm back in the chair.
All right, good.
Okay.
I missed one from Chels about bleeding or something.
Oh yeah, Chelsea's got a series of questions. You want me to go right to it?
Fire.
Hey, bestie, that's you.
That's me.
Because that's singular.
Well, it could be both of us.
No, it'd be besties.
There you go. Okay.
Besties is not written.
Yeah.
Maybe I don't read the question. My friend has been bleeding for 24 hours with clots. 7 weeks. Is it likely miscarriage? Question mark. Myself, on the other hand, almost 16 weeks, thanks to your fine self.
Well, I'm glad about you. I'm sorry about your friend. 7 weeks with heavy bleeding, you got to go get checked out. There's no way to know. I mean, I've seen people with torrential bleeds who maintain the pregnancy and other people who don't. So there's no way to know, but if she's 7 weeks, they should be able to see the fetus on ultrasound. So I would go get checked out for sure.
I wasn't following TikTok because I was trying to get everything.
She said, I love you, Tarek. Don't get it twisted.
All right. No twisting. Don't you worry. My question was to you, right? The question that you read, did you do a question about ureaplasma on TikTok?
I did the one on ureaplasma, yeah.
Did you do the question, I don't have high blood pressure or gestational diabetes?
So that was the one where she was asking why they're monitoring her more. I don't know why they're monitoring you more. I'm not aware of any guideline anywhere that says that for heavier women, they should have heightened monitoring. I'm not going to argue that it doesn't make sense. I actually do think it makes sense. women with higher BMI have higher complications, including stillbirth. If you go on our website, we have this super detailed, like basically brochure about what happens when you have BMI. So it's under the resources tab, you click it, and then it takes you to all the different resources. We have a whole section on BMI and fertility. So, things like stillbirth are increased, diabetes, preeclampsia, adverse outcomes, cesarean section, wound complications, everything. Like it's all increased. So I'm not against monitoring. I'm just not aware that anyone has actually said you should do that.
Is it safe to continue my metformin during pregnancy? I'm willing to get into my OB and laser.
Totally. Yeah, it's absolutely safe. In Canada, they don't do it very much, but they've been doing it in the States for a long, long time. So there's nothing wrong with doing that.
Dr. B in high tea, how was your holiday? Please, what size of uterus is considered normal?
How was your holiday?
My holiday was phenomenal.
It was phenomenal.
It was very hot.
Very,
Very, very hot. I consider myself relatively brown skin, if
Yeah.
that makes sense.
yeah.
So I believe I am one with the sun.
Yeah,
So I didn't feel I needed to worry about the sun.
but you needed to worry about
But
it.
the African sun is serious. It'll teach everybody a lesson.
It'll teach everybody a lesson.
Yeah.
So how are the pyramids?
Oh, you know what?
Super cool.
Look. So I've always been quite proud of my quote unquote Egyptian
Heritage.
heritage. You know, I built the pyramids, is what I say. This is my relatives. You know, these are my people.
These are your people.
Yeah. But one thing that I never realized is how similar the blocks are. Like we had a tour
Like how
guide.
perfectly. it's
Yeah.
made.
Like my tour guide went on a, quite the length to explain that he truly believes that this generation of people are probably smarter than the people that exist right now.
Wow, they got all those blocks up there somehow.
And so that's always what I thought, right? They have the blocks up there, they stacked it in a pyramid shape. What a marvel, what a mind blowing, wow, huge blocks, how they do it. So inside there's caverns.
Yeah,
There's a cabinet inside that's probably 20 feet high.
pretty good engineering.
So all my life, it's just like, okay, they built a pyramid shaped triangle thing out of blocks. I didn't belittle it, but like, okay, like I get it. But now there's rooms inside and huge rooms, huge rooms.
Yeah,
So I don't understand. Like I had a hard time understanding how they built them in the first place.
yeah,
But let's pretend I got it.
yeah.
I don't get
The inside.
The inside.
engineering.
the engineering
That's
of the
cool.
inside.
All right. Cool.
I'm not gonna take up the whole show with these kind of comments, but for those that want to see something interesting, the pyramids are definitely worth it.
Very good.
Another question.
Yeah.
Normal, did you answer that question? The actual part of the question? What was the size of the uterus is considered normal?
Oh, no, we didn't answer
Yeah, there you
that. Normal uterus size, about 7 to 8 centimeters long, 3 to 5 centimeters wide, and same for depth.
Hello, dear Dr. Victory and T. Modified natural was 75 IE. Gono, estrogel, Vag, Viagra, still only 6 millimeters, lining on CD15, lead follicle 20 millimeters, canceled again. Don't know where to go from here.
Is that Jana?
It is, yeah.
Oh, Jana, I'm sorry. There is nowhere to go from there. I mean, the only thing, and you did PRP as well. There's nothing else. There really isn't. You could try, I don't know if you've tried Neupogen and human growth hormone. Those have been shown to increase it as well. I don't know that you can do more than what you've already done. Yeah. The only other thing would be injectable estrogen to see if your body responds differently. Or focus on just using vaginal estrogen. I'm sorry, sweetie. I love Jana. She's a sweetheart. No, it's too bad.
Hi, Dr. V. Do you ever use PIO for fresh transfer? Had a day 3 fresh transfer, 6X retrieved, as had 0 blasts last IVF. After was on 2 months of Lupron, Depot, Letrozole, last dose May. Continued below. On prog, 400 milligrams vaginal BID since 1 day pre-transfer plus told to start PIO, 50 milligrams IM, Q3D, 3 days post-transfer tomorrow. My level hasn't been checked. I read PIO isn't typical for fresh transfer. Your thoughts?
Well, you need to know what your progesterone levels are, because with a fresh transfer, your body's producing progesterone from all the eggs that you got. So you could actually overshoot and basically cause birth control. So we don't do it without checking. So I don't know that I would advise you to do anything without checking. If your progesterone levels are low, I mean, we always advocate for double progesterone, but not if your systemic normal progesterone is super high. You're going to overshoot. So get your levels checked.
How do you test male and female immunological infertility?
NK cells in the woman, NK cytotoxicity, T regulatory cells, cytokines, interferon gamma, TNF alpha. We look at the presence of paternal antibodies or antipaternal antibodies, leukocyte antigen detection test, or leukocyte antibody, detection. We do DQ alpha screening, and then in some cases we do KIR as well. So that's the testing we do through Fertility.
Hello, gentlemen. When would one typically start estrogen to thicken the lining? I already mentioned to use it after trigger.
We did
Did
that.
that?
Yeah.
What would classify someone to have PCOS?
Well, there is strict criteria, which quite frankly, I don't follow. Everybody wants to categorize people with PCOS and say, you only have PCOS if you fit these criteria. So it's, evidence of elevated androgens, things like acne, hair growth, oily skin, hair loss, balding, that kind of thing. And then you have to have irregular periods, and then biochemical evidence of elevated androgens, so high testosterone, DHEA, so on. But the reality is that PCOS is very much like a spectrum. You can have people with really mild PCO, and you can have people with really bad PCO. They don't all present the same. So I've always fought against this idea that PCO is only present when you have one specific thing, because we have to treat many of the patients who are milder the same way that we treat the patients that are severe. So it doesn't make sense to say, oh, their androgens aren't that elevated, so you skip the treatment. No, of course not. You still have to help those people. So there are criteria, but I personally don't follow those criteria.
Best FET protocol for thin lining?
Depends how thin. You can try vaginal. I mean, there's not one protocol. There are things you can try. So you could try letrozole, you can try stimulation with gonal-F, you can try vaginal Viagra, PRP, L-arginine, L-carnitine, baby aspirin, vitamin C, D, and E, human growth hormone, and Neupogen. All of those have independently been shown to thicken the lining, so they're all kind of reasonable. You can try any of them. But there's no one single protocol that's better than everybody else's.
How can my wife monitor at your clinic on a long weekend with no ultrasound or blood stuff?
Why does everybody think that there's no ultrasound blood stuff? So we have full staff on Saturdays, and on Sundays, if we don't have full staff, which we do, even if there's no ultrasonographer present, I do the monitoring myself, and I know how to run everything here, including the blood machine. So it's not a problem. We always have the availability to do monitoring.
And if you're ever in a pickle,
we can always call Tara.
there you go.
Yeah.
Absolutely.
Yeah.
That's why.
Good luck getting him in here on a Sunday. You never know. Yes.
Dr. Victory and Dr. T. Looks like I'm back.
You're back,
I'm back.
baby. You're
I'm
back. Yeah.
I even skipped a couple questions for today, just so they know.
That's cheating, man.
A good intro goes a long way. I have focal adeno and have had 5 MC with normal embryos.
Oh,
Last transfer with your protocol, stage 4 endo, did fertility. Should I get the focal adeno removed with endo lap?
I mean, I would want to know if there was anything else going on. So I need to relook at everything you had. But yes, I mean, if you've tried everything else and there's focal adeno and you're still miscarrying and you used our protocol in full, then yeah, I mean, we got to do everything else possible.
I had a medicated transfer on Monday after 6 retrievals, and I'm so afraid it won't work. I have stage 1 endo cauterized a year ago.
Yeah.
And had down the ERA, which showed I needed 126 hours of progesterone.
Oh, it's fine. 6 hours won't make a difference.
That's
Just a comment.
mm-hmm.
Well, we'll pray for you. I don't do medicated protocols, especially for endo, but hang in there and lots of prayers. Everybody put their hands together and we'll see however we're going to do that. Chell says, whenever you're in Woodstock, I'm going to come get your autograph. Woodstock Clinic should open up in a month. So hopefully very soon, maybe even sooner.
We'll go live from there.
We'll do
party.
live. Yeah, that, you know, that would be fun. We should go to St. Cath and do
Maybe we do a live,
St. Cath
live,
soon.
a live. Like invite people in the area to
Oh,
come.
like come in and meet us.
Yeah.
Oh, yay.
Not bad, right?
Yeah, that'd be fun.
Yeah.
Yeah, see who would come on the show. Yeah. All right.
Would someone having 14 follicles on one ovary classify as PCOS and need metformin?
No. The number of eggs you have does not define you as PCOS. It's the symptoms, the hair growth, the acne, the irregular periods, the weight gain, the oily skin, the, you know, like scalp hair balding, the irregularity of your cycles, that kind of thing. That's, and then of course, biochemical evidence, like I said earlier. So just the number of follicles is not criteria. You can have a PCOS appearance to your ovary, and that's being argued back and forth that it should be included as criteria as well, but not just purely the number of follicles you have. We have women with loads of follicles, but they're not PCO, and that's okay.
Well, Dr. B, with testosterone priming, is it important to monitor testosterone levels? And is there target level to be under?
No, it isn't important to monitor, and there's no target level to be under.
We missed you, T.
Oh,
I missed you too.
I missed it. It was not the same without you. In particular, the meals, they sucked.
A week without me, eh?
It sucked. Yeah. I mean, one time I actually went home and ate at home because it was lame without you. The meals are good. Yeah. We had burgers tonight from, where did we eat it from? Cranky Burger, which is like literally a hole in the wall. We could barely find it. They make damn good burgers.
Oh, yeah.
It was
Very
a very
impressive.
good burger.
Yeah,
A
very
bit salty, but a very good burger.
I was impressed with it, to be
Yeah.
honest.
Yeah.
I didn't think I would be. I'm like, I'd probably make it better at home, but you know what?
Yeah.
This guy challenges me.
Chell says she's going to show up waving posters like.
There you go. See? 100%. I'm telling you, we should do it. Hi, Dr. Victory and Mr. T. Do you recommend fish oils with your endo-adeno-FET protocol?
Yes.
Is there a bleeding risk with fish oils? I have adeno immune issues and RPL. Thank you both.
We've never seen any evidence to suggest that there's an increased risk of bleeding in pregnancy with fish oils. And I don't think endo-adeno would change that. You are at an increased risk of bleeding with endo and adeno, but I don't think the fish oils would make that worse because their anti-inflammatory impact is very significant. So I think that's good. Oh, see, Paige, I'd show up with brownies.
I'm very convinced that we
Paige?
should do this. Absolutely.
You know my heart, Paige. I love my brownies.
Who doesn't love brownies?
I love a good brownie.
Oh, yeah.
We got a bunch from, I took a bunch for my birthday when I went up to the cottage
Okay.
at Mrs. Fields in Detroit. Oh, so good.
This feels pretty good for a chain
The
egg.
brownies are awesome. They're
Seems
really
pretty
good.
good.
They need icing, but they're otherwise awesome. Yeah,
Is it safe to continue my metformin for PCO?
we did that.
Okay.
Yeah.
What adverse outcome does high dose estro cause after FET? I got a large SCH 6 estro a day.
6 estrogen a day? Oh my God, that's insane. Preeclampsia has been shown to be higher. IUGR has been shown to be higher, which is growth restriction. Small for gestational age babies has been shown to be higher. Miscarriage has been shown to be higher. So I would talk to your doctor about your dose and see if they're agreeable with weaning, but I don't want to mess up anything for you. So talk to your doctor. Do not do anything on your own. Always talk to your doctor, but we don't ever go that high, ever.
What should my levels be at for progesterone after my transfer with stage 1 endo? They have me at 800 milligrams of vaginal progesterone, then 1 mil of PIO every third day. What level should I be at?
So it's going to be hard to keep it steady because you're doing the PIO every 3 days. So it depends on where you measure it. But if you have stage 1 endo, we're looking for in Canadian units 130 to 150, and in American units 37 to 45.
Is monkeypox deadly?
No idea. I don't know anything about monkeypox. I think it's deadly. Do you know anything about monkeypox?
They're trying to make it a
thing?
A thing.
Yeah.
It's
I saw
creeping
some-
up as a thing.
I saw some stuff about it before. I really don't know anything about monkeypox. And Lord knows if they have another pandemic, I'm moving to Antarctica.
I'm out.
So,
I'm out. I'm done.
Yeah.
I'm done.
I am not going back into hibernation
Never
or
again.
shutting down the world again. Like, honestly, I pray that they don't do that. It was such a ridiculous experiment in, like, public crowd control. It was ridiculous, crazy. Those guys from the CDC said, like, they admitted, Fauci, he's like, yeah, we were just making stuff up. We didn't know what to do.
Wow.
They're like, we just did what we thought was best. It wasn't based on evidence. We just figured this made sense. I mean, I applaud them for doing their best, but they shut the world down. It was a bit much.
Yeah, a little bit more.
Yeah.
That's necessary.
It was a little much. Yeah.
Greetings.
Greetings. Hello.
What's a good lining for Femera and timed intercourse? Does 8 millimeters still apply?
Yeah, 8 millimeters always applies. Yeah.
Thoughts on Omnitrope, stage 3 endo AMH 4.71, AFC 20, age 36, almost 37, want best first shot as possible for egg quality. Also thoughts on Zymo plus ICSI if DNA fragmentation comes back high. For first time retrieval.
So those numbers don't make sense unless you're talking 4 nanograms per mil instead of picomoles per liter. If you have 4 picomoles per liter, there's no way you had 20 follicles. One of those two things is wrong. If you have 4 nanograms per mil, yes, absolutely, that's possible because that's a really high AMH. As far as human growth hormone, we typically only use it for patients who either have egg maturation problems because it has been shown to increase the maturity of the eggs, or if we have women with weaker ovaries. I've never used it in someone with normal ovaries who has lots of ovarian reserve, but you need to figure out your ovarian reserve because the 20 antral follicle count and the 4 AMH don't fit unless the 4 is nanograms per mil.
After embryo transfer, fresh or frozen,
Yeah.
what blood work do you monitor for endo patients and what target ranges are you aiming for?
Just progesterone, and in Canadian units 130 to 150 and in American 37 to 45. There is no other blood work to monitor. There's nothing you're going to check that you can adjust or alter. There are people that believe you can, but I'm not a believer in that. At that point, the pregnancy is either established or it isn't. I don't think things will make a difference.
What is your take on evidence of L-arginine and vitamin E in endometrium lining and thickening? What is the dose recommendation for this purpose?
Vitamin E is 800. I don't know what the dose is for L-arginine, but it'd be easy to look up. But there is evidence that both of those support lining thickening. So yes, they are reasonable. And I don't use L-arginine because we are usually good at getting our lining thick enough, but it has been used. There's a great question on TikTok. Should I just take it?
Sure, go for it.
Hello from here, H-E-E-R. Hello, endometrius. I think they mean endometriosis. Can be one of the reasons for implantation failure. Do you advise Emma, Alice, and Era? So I'm not sure if you're saying endometriosis or endometritis. Maybe you're saying endometritis. So if you have endometritis, it is definitely a possible cause of implantation failure. I recommend a test of your uterine microbiome. I don't personally use Emma, Alice. I like Fertility much better, but the ERA test is proven to be useless. That's got to be one of our Raspberry Awards. There's a doctor in the US that insisted to a US couple that they use the ERA test.
Really?
Swore by it, like insisting that this is the way to go. So I showed them the study which shows it's got a 13% decrease in success. They were like, wow. They said, no, this guy's like really well known. I'm like, well, he's not reading enough because he had no idea. Yeah. On the bright side, we had a couple here from Colorado today doing their embryo transfer. And they mentioned that on their Facebook group, everybody with stage 4 endo that had used our protocol had said that they had gotten pregnant for the first time after loads of failures.
Oh, wow.
Yeah. Yeah. So that was cool. And I guess the protocol is out there. Like, I mean, we put it on the YouTube, YouTube. But like the actual typed up protocol, people are just like sharing it now.
Dr. Victor's protocol?
Yeah, so like people are trying it all over. It's cool. Yeah. It's nice to know people are getting help. Yeah. Yeah. I know. Very cool. Very cool. Yeah. Oh, there you go. Fitnix asking protocol for transfer with endo. So we have a whole video on it on our YouTube channel, but I'll give you the short version, which is long. So Lupron for 3 months with letrozole, then you just come off the letrozole, you wait for your lining to thicken, take no or minimal estrogen if possible, double progesterone, high dose, you got to get your progesterone value checked after 3 days, good embryo transfer, 5 different supplements, NAC, coenzyme Q10, curcumin, resveratrol, ALA, plus your basics. And then you need to do an immune protocol, which is intralipid steroids and tacrolimus.
Does agglutination severely
Agglutination.
agglutination, yes. Does agglutination severely impact the success rate of IUI?
It can, depending on the sperm count and the amount of agglutination. The sperm that are agglutinated are clumped together with their heads all kind of stuck together. So when you centrifuge them, they don't go through to where you want them to go through to. Yeah. So it can make a difference for sure.
Do you suggest adenomyomectomy for diffuse adenomyosis?
By definition, you can't do an adenomyomectomy for diffuse adenomyosis. Diffuse adenomyosis is little splotches and sprinkles of adenomyosis all through the pelvis. You can't do a surgery for that because you can't go and get it. You have to use suppression for that. The only time you can operate on adenomyosis is when you have an adenomyoma, which is like a tumor of adenomyosis in the uterus, like a fibroid, but it's made of adenomyosis. And I hate doing those surgeries. The worst gynecologic surgery because it is brutal. You are tearing apart the uterus no matter what you do.
Thoughts on intermittent fasting while TTC for weight loss, 10 to 12 pounds transfer in about 2 months.
Yeah, it's great. Intermittent fasting is helpful for losing weight, and the more weight you lose, if you're overweight, the better you're going to do with your fertility. I spoke to a lovely, actually a very enchanting Muslim lady the other day at the request of a friend, and her BMI was elevated. And when I heard what had happened for her and what the clinic she was attending had done, I was genuinely shocked. It was wildly inappropriate to even attempt it at the BMI that this patient was at. And I really feel like, you know, we should be doing better as doctors. So it is important to make sure that you're getting the right advice and following through on the right answers rather than just kind of going blindly into things.
Should I be on anti-inflammatory diet for adenomyosis?
I'm not sure what an anti-inflammatory diet is. So I'll give you a good example. A lot of naturopaths will tell their patients to stop eating dairy and stop eating gluten because they strongly believe it creates a lot of inflammation. Fine. I'm not a naturopath. I'm not qualified to comment on that. What I can say is that the science actually shows that patients that eat dairy actually have better outcomes when they have endometriosis. So I am not a believer in elimination diets. What is an anti-inflammatory diet? Lots of vitamins, lots of vegetables, some fruits, low red meat, that kind of thing. Should everybody be on that? Yeah, the whole world should be doing that. Like, that's just healthy. But is there like an elimination diet you should be on? I personally don't believe so, no.
Thoughts on intermittent fasting while trying to conceive for weight loss? Oh, you did that, yeah.
Yeah.
Should I take an omega-3 supplement with my Materna while pregnant?
Yeah, absolutely you should. Because it doesn't have enough in it, if any.
Hello.
Materna doesn't have any.
Endometriosis can be one. Oh, did you read that one? Alice?
Yeah.
Yeah, you did.
Yeah.
Protocol for transfer with it. No, you did that. Should I continue my CoQ10 now that I'm pregnant? Also, can I take omega-3 with Materna?
Omega-3 with Materna, you asked, yes. CoQ10 you don't need, so that doesn't matter. Yeah.
Won't intermittent fasting put stress on the body and affect hormones?
No, intermittent fasting has been shown to reduce your insulin levels, so it actually de-stresses your body. So it's a good thing.
Is this size of uterus considered bulky? Here is the measurements. 6.2 by 7.2 by 8.9 centimeters. Where would you want this to be
no.
to be considered normal size if not?
The sevens may be a bit large, but no, I wouldn't consider that bulky.
How much progesterone and what route do you usually prescribe for a fresh transfer?
Again, you can't answer that without knowing what so progesterone for a fresh transfer must be individualized because the patient's corpus luteal, and there will be multiple if they had multiple follicles, needs to be adjusted against what's, what they're doing. So you have to test to see where they're at. Now we would start at a certain level, but we would bring you back for testing to see where you're going. So we'd normally start with 203 times a day of prometrium and 1 mil of PIO, or 50 milligrams, but you need to be tested to see where you're at so that they can be adjusted. And it actually needs a lot of testing because initially your natural progesterone levels are going to go up and then they're going to fall, and you got to actually decrease the amount of progesterone you give the patient initially and then increase it as their progesterone levels are falling. It's kind of chaos. That's why part of the reason I don't love fresh transfers.
How long after starting DHEA does ovarian reserve function improve?
Well, they say 3 months. We typically will see some improvement in about 1.5 to 2, but the studies supported the idea that you should be doing it for 3 months.
Hi, Dr. V. I just had a miscarriage after an FET. We have 2 embryos left, both for BB. This will be our 4th transfer, 1 resulting in a live birth, 1 failure, 1 miscarriage. Should we transfer both for BBs or only 1?
I'm always an advocate for just doing 1. I just think it's safer, but if you want to do 2 because you only have 2 left and your age is a factor or something like that, it's not unreasonable, but keep in mind if you get pregnant with twins, it's a high-risk pregnancy. Comes with complications for mom, complications for the babies, and what I like to refer to as social complications because the divorce rate with twins is 80%. So I'm never advocating for 2. We always advocate for 1.
It's much harder.
Tarek has 2, he knows. It's a lot more stress. Yeah.
13 weeks, 5 days pregnant, had bleeding at 5 weeks due to subchronic hematoma. 2 days ago started bleeding, ultrasound shows no SCH, heart rate 155 measuring on track. Stopped prog approximately 4 days ago. What can I do?
Make sure you're not on any blood thinners and go back on your progesterone is what we would do, but you got to talk to your doctor.
Should I be worried about progesterone levels?
Yes. Everybody should be worried about their progesterone levels. Yeah. I love some of the questions.
That's not good.
Should I be worried? Yes, you should be worried. Yeah.
Had egg retrieval today, got 24 eggs.
Woo.
Last estradiol level 2 days ago was 2109, and they are monitoring me for OHSS. Should I be concerned with that level?
If that's American units, it's high-ish. If it's Canadian units, I don't understand how you got 20 eggs. So no. But if it's American units, yes. And it would depend on how you were triggered as far as your risk of OHSS. So did you get HCG? And if you did, how much?
Does 14 follicles on one ovary, we do that one?
Yeah.
That's 14 follicles. Just a review. Dr. B, are there any tests on the market to get an idea if hostile cervical mucus is contributing to unexplained infertility?
Oh, interesting question. Not that I'm aware of. Hostile cervical mucus would just be the thickness of the mucus. If you're really worried about that, take Mucinex, which has been shown to thin out the cervical mucus. So that's probably the easiest way, or learn how to remove the mucus and get it removed. You need some equipment for that, but it's doable.
When do you recommend couples do genetic carrier screening, and who should be tested for Fragile X?
Well, ideally, everybody would get testing for carrier screening, but when do we definitely recommend it? Couples who have had a child with any kind of disease, couples with family history of diseases that are known to be genetically linked, couples that have married within their family. So we get a lot of people from countries like Pakistan, the Middle East, where they've married their first cousin. So I know that's very foreign to people in North America, but it is not foreign to people in other parts of the world. And so those people all need to do it because the risk of having recessive gene crossover where they both have the same thing is sky high. And I've seen it go very, very, very wrong. So we insist on it for those couples. Those are the main people that should be getting it done.
I had a medicated frozen transfer on Monday, and I've requested my clinic to test my progesterone. I had stage 1 endo cauterized and a year ago, and had done an ERA test that told me I needed, oh, we did that. 126 hours. What should?
The progesterone be?
Hmm.
Yeah, I don't know why people are re-asking questions. Hang on, let me do this one.
Mhm.
Is 21-day progesterone for a healthy pregnancy still 37 to 45 for women with PCOS? Is 21-day progesterone? I have no idea what that question means. The 37 to 45 is your progesterone level if you're doing a frozen embryo transfer, not for women with PCOS, if you're trying naturally. Charles, if I've been skipping my prenatal, Charles, stop skipping your prenatal. They make me gag and die. Is that super bad? Yes, of course it's super bad. Take Flintstones. No one pukes with Flintstones. Just take like 3 a day.
You can do that?
Yeah.
Where was that advice?
No one pukes with Flintstones. I've
That's
done it a
true.
million times. Like, every single time you give women Flintstones, they don't puke.
You know that one always made my wife throw up the,
Right by folic five.
yeah, that's the one.
Yeah, it's heavy in the folic acid.
It's heavy, eh?
Yeah.
It was a guarantee. I was like, and the whole time I was like, oh, come on, it's just a pick. Just swallow it already. What's the struggle? But apparently it's a struggle. Apparently it's a struggle.
Okay, you know how we've had that whole conversation. You said swallow, so this triggered my memory. You know, we've had the whole conversation about telling people that if they swallow, it's good for anti-paternal antibodies.
Yes.
So I had a lady show up.
Oh, here we go.
She tried it after years of infertility, got pregnant.
No way.
Yeah.
Really?
Yeah. So I guess it might work. Wow. Who knows? Yeah, very funny. Yeah, she's like, it was great for my marriage and I got pregnant. I'm like, yeah, that's a great ad. I love that.
This is officially Fertility Faction After Hours. We just walked into it.
Yeah, it worked. I mean, granted, we did do live for her as well, but she
Sure.
also did that. And she was like, yeah, I think that was wild. Very cool. Very, very cool.
But no, honest to God, it makes sense. Honestly,
Yeah.
it makes sense. Friend got a plus 1 day after Lupron shot. Positive 1 day after a Lupron shot, I guess.
Yeah.
She's on prog now.
Yeah.
What are your thoughts on this going forward?
It's fine as long as she's on the progesterone. I put her on the progesterone. I know who you're talking about.
Okay.
Yeah.
I saw on histogram when going through fertility checks and pregnant the month after.
Awesome. About 10% of our patients get pregnant just from our testing. I think it's really just blowing out the tubes and opening things up. So that happens very commonly. We see that all the time. We're really happy when that happens because they don't need anything. Just a quick test.
Thanks, Dr. VNT, for answering my question. Pregnant with PCOS and had a miscarriage before. So nervous.
Understandable. We're always here for you. Dr. VNT.
Wow, this call for turned rated R. Guys, there's a real thing about fertility or fiction after dark, right? That's what it's called. Yeah, that's a real thing. You got to be careful. This conversation at any moment can just turn.
It can turn. Yeah,
It can turn.
we've had some wild ones.
Yeah, we are always trying our best to stay PG, but sometimes I hear a knocking.
It doesn't.
I have to answer. 26 weeks to Dr. B. Iron is tanking 8 even with prenatal. Any extra suggestions?
Yeah, take Ferromax or Palafor or one of those. If that's still not enough, you need to take IV iron, and that works really well. And now we can routinely use the isomaltose version of it, so you only need it once, and it only takes an hour, and you're in and out, and it works great.
Is vaginal estrogen less detrimental than oral? They suggested patches now. I'm so desperate.
Well, theoretically, the patches and the vaginal probably have the least inflammatory response. The oral would have the most. So if you're going to use one, use the patches or the vaginal.
Antagonist protocol. Estradiol starting 2D after OPK positive till start of stems on cycle day 2.
Okay. So
That is all.
priming.
letrozole 5 milligrams, first 5 days of stim. Meno 150, gonal 300.
Wow.
Cetrotide starting day 6, dual trigger. Thoughts?
Estrogen priming has been proven to be useless in 2 different randomized controlled trials, so we don't do it. We never have. I probably never will at this point. So that's of no value. We tried letrozole. I also found that useless. In fact, that was really detrimental, so we stopped doing it. I may have been doing it wrong, but I stopped, and I'm happy with our results as they are. And then as far as the dose of the medications, there's pretty good evidence that that dose is of no benefit, because once you go over 300, there's no advantage to going to 450 or 600. So I don't know why you're on such high doses. That doesn't make any sense. Double trigger is great. So they got that part of it right. And I don't do fixed antagonist start dates. So I don't go like only day 6. I mean, sometimes if you start on day 6, you've missed it. It's too late, because by day 5, like some of our egg donors, we would be in trouble. They'll release. And other times you need an extra day before you started. So I'm not a big believer in the fixed start, although the studies show it does have the same outcome.
Quick question. How do I make sure I get twins?
So Charles wrote, "You can't, homie." Yeah, you can't make sure you have twins. And to be honest with you, you shouldn't be trying for twins. It's high risk. It's complicated. There are multiple adverse outcomes associated with it. So we try really hard to avoid that. Is it possible to increase your chances? I mean, sure, we have people who are 45, they're doing donor egg, whatever. They don't want to be pregnant again at 47, 48. So they want like what we call one and done, just one pregnancy and make it happen. And if that's your situation, that's different. So if you put in 2 euploid embryos, you have a very high chance of ending up with twins. Do we advocate for that? No. But can you do it? Sure. Yeah.
I heard there was a technique involving chandeliers or something, but I guess that's just an old wives' tale.
Don't swing from the chandelier. That won't help.
Thanks, Dr. V&T, for answering my questions. Pregnant with PCOS and had a miscarriage before. So nervous.
Oh, yeah, you read that one.
Is 21-day progesterone for a healthy pregnancy still 37.45 for women with
I
PCOS?
answered that one too. I think we're ahead of there.
Okay.
We're at the thought of 2 newborns frightened me. So now we got to go back to
It's manageable, but they win every time.
Yeah,
Yeah, sure. Well, you're outnumbered.
you're outnumbered.
You're always outnumbered. Once you have twins, you're outnumbered. Kids win. You just gotta know it. That's it.
Tarek's had twins. He
Yeah,
knows. Yeah.
It's just
Yeah.
the worst twin experience. If I may share a bittersweet story.
Sure.
So my wife comes up with the novel idea that we should go to Niagara Falls.
Yeah.
Me being the loving, caring, compassionate, understanding husband that I am.
Yeah, of course.
Of course, say, of course,
Yeah.
let's do this.
Yeah. With the twins.
Of course,
Right.
with the twins.
They're born.
We're a family
They're
now.
out.
We have to
Yeah.
go together.
They're out.
Yeah, they're out. Mind you, not a big fan of Niagara Falls in general.
Oh, okay.
The whole thing is just, big water moving. I get it.
Okay.
The problem, of course, happens when my wife decides to be adventurous and courageous. And she feels that we should go to Lundy's Lane. So I got this giant double stroller. One on the left, one on the right. At this time, we didn't think that front and back was a good idea. We thought side by side is the way to go.
Yeah, yeah, yeah.
And, there's a lot of people.
There's a lot of
There is a lot of people. So maneuvering that, I was like the most hated person in the world.
because there's not that much.
There's no room.
Yeah,
So I'm getting all these side looks,
yeah.
and I'm slightly dark skin color, so I didn't really fit the "hey, you're welcome to be here" kind of look,
Okay.
So I was getting a little bit of racial profiling, if you will.
Right.
But the biggest problem was at night when we had to go up to the hotel.
Oh, yeah, yeah, yeah.
Because we have to go
You gotta
upwards
go
now
with that thing. Yeah, yeah, yeah.
with a stroller and
Right.
2 kids obviously crying because they don't want to be there.
Right.
So it was a disaster. Now, I never mentioned it to my wife again. I never said it was a horrible trip and nothing good about it
Yeah.
happened at all. But now that you know, time has gone by. I figure I share my,
Now you love the twins and everything.
yeah, so I share my reflection with
There you
everybody.
go. Yeah, twins is tough. There's no question.
Yeah,
Yeah. Yeah.
okay. All my labs are good except DHEA is high. The doctor recommends progesterone with letrozole 2.5 first round. I ovulate regularly, but 40-day periods. Can I request 5 milligrams?
Sure, you can request 5 mega. We start at 5, so you can request anything you like. There's nothing wrong with that.
Chelsea says we're even better friends now. She
That's
enjoys the
because
stories.
she's getting twinsies.
Oh, I see. I got plenty of advice I can give.
I saw Carly, she came up.
Carly showed up.
She said
Yeah,
she
welcome,
misses,
Carly.
she misses coming to the office.
Well, we miss her coming on the show.
I know, I do too.
Yeah, absolutely.
I do follow her though, so that's cute. Yeah, I see her smooshing her little baby.
Yeah.
Yeah.
The thoughts of 2 newborns frighten me. Yeah, we did that. I miss one. Oh my God. My friend showed me a video of her girl screaming, and please no. Okay. It's hard to find out where's comments and where's questions sometimes. You know what I mean? The only cool thing about twins is the perks of saying yes, they're twins. Yes, they're identical.
Chell says hers are 6. She's a seasoned veteran.
Oh, I see. She's mastered it then.
Yeah.
Please, can you tell me what my levels of progesterone should be at following my FET?
If you're not not endo, between 10 and 30 in the US units, which is 40 to 100 Canadian. If you are endo, 130 to 150 Canadian, 37 to 45 US.
Well, her twins are 6 years old. That's
Yeah.
what she said?
Yeah.
Well, mine are 15.
Yeah.
I'm a super veteran.
Yeah.
Mine are going into grade 10.
Yeah, yours.
That's serious.
You do have very nice girls. Yeah. Well, all your kids are sweet, but
Oh, thank
yeah,
you.
they're good mother. Don't get too excited.
Great father. Father of the year, all year, every year.
Yeah.
Yeah. If your PGT testing comes back invalid,
Yeah.
what does that mean? And are you still charged for testing that didn't give you the results?
That's a good question. So we charge as a bundle. And so you all will be charged for that, and they still ran the test, it just didn't work. So yes, I think they probably do charge you for it. What does it mean? It just means that when they process the DNA, it actually didn't work. And that happens all the time. Sarah, you asked that question off of TikTok on one of the other platforms and we answered it, but I'm already managing that. So yeah, as long as you take progesterone, nothing happens.
AMH is NG over ML. I guess that's
Oh,
one of the
four.
Yeah.
Oh, yeah, then that's reasonable. Oh, we're almost at the time, eh? That's wow.
That's the love that I bring to the
No,
show.
you didn't do it.
I missed.
You missed. There you go.
There you go.
Verification complete.
What a strange thing.
I know, it is kind of silly.
Like 58 minutes, they're like, oh, maybe you're not here anymore. What would you do in case of a 18 millimeter follicle, 6.6 millimeter lining, CD10, wait it out before triggering? What if the lining isn't thick enough? What would one do in this case?
I would trigger and then I would add in some estrogen, a low dose. Yeah.
Tell says, don't be too excited to leave. We're never excited to leave.
We're never excited.
We wait all week for this show.
Yeah.
My whole calendar is based, my whole life is based on this Tuesday show.
I love the show.
Even when I was in Egypt, I couldn't even sleep on Tuesday. I was just wired. I was wired. And sure enough, there was technical difficulties. I had to show up anyway.
Yeah, that's right. The first
Yeah,
one.
so my heart was full. My heart was palpitating. I couldn't do it.
Yeah, that first one you had to show.
I showed up.
Yeah.
I think I showed up even for
Was
the
it the
third
first
one.
one or the second one?
I showed up twice.
No, once. I did two. No, I did 2 with Robin,
Yeah,
right?
yeah.
I did 2 with her, 1 with you.
I think I did too. I did the first one with you. I don't know how many shows I did, but I did 2 with you.
There were 3 shows.
No, 4 shows.
No, that was before you left.
Oh, that was before I left.
There
Oh,
was
okay.
another one we didn't make it to. Yeah.
Oh, okay. Either way, I love the show.
I love the show too. Yeah.
Doctor refuses. Oh, this is a great start for a question. History of stage 1 endo.
Okay.
Treated with Lupron after retrieval.
Okay.
3 miscarriages back to back to back.
Okay.
First 2 were untested FUTs.
Okay.
Third was spontaneous natural twin pregnancy.
Oh,
All three ended at 4 to 5 weeks.
okay.
Ready for this part?
No.
Doctor refuses any further testing since I have a 3-year-old son conceived naturally, 10 pounds at birth. Where do I go from here? I have 3 embryos left.
You come to us, you need fertility testing, you need genetic testing, you need sperm DNA fragmentation testing. I need to know your general health, your body mass index. We need to look at your uterus really carefully, look for infections, check your thyroid, check your vitamins, check your hormones. Like that needs comprehensive investigations. Every guideline says that after 3 you should check. So that has nothing to do with how many babies you've had before. I'd love to know which doctor that is. That makes zero sense to me.
You know, it's
That
funny.
makes zero sense.
Oh yeah, you know,
That's worthy of you know what? You should,
there's a raspberry.
that's a raspberry right there. Yeah.
Yeah, absolutely.
That's a-
You know, I'm always shocked if I may. You know, I'm not remotely a medical student, let alone a doctor. I act like one sometimes, and potentially have a lot of knowledge.
Sure.
And in certain circles where you're not there, and someone asks a fertility /
You're
OB question, I'm definitely on.
Yeah.
Definitely on.
Yeah.
I can't shy away from them. But I will say, when I hear that patients have doctors that categorically deny their requests or
Yeah.
questions or thoughts, I don't even get it. Like if I go, like lowest case example, if I go to McDonald's
Yeah.
and say, hey, can I have a Big Mac with an extra patty? Really bad example, but they'll engage. They'll say, yeah, okay. And that's like the most basic form of
Yeah.
customer care, patient care. Like that's the most basic form. You're a doctor with three miscarriages, and the doctor's like, yeah, I'm not going to test anything.
Yeah. You know, the hardest part for me too is that the patients are paying for this.
That's right.
One way or another. Like even if you're funded, you're probably paying for some meds, you're paying for this, you're paying for that. Like, how the hell are you going to justify that?
I'm here is the right answer.
It doesn't make sense. Like, it really just doesn't. You can't tell people I refuse. You can have a robust discussion, right? Like I had a conversation today with a lady. She had innumerable fibroids, age up there, very up there, too high to be reasonable for conception. Basically menopausal, and she wants her fibroids removed so she could try. And she's like, I think that's going to help me. He said, it's not going to help you. Like by the time I get to this, do your surgery. You're already going to be in menopause. But she said, you know what? I want to try it. I was like, okay, this makes no sense, but if that's what you want to do, I'm going to support you. Like our job isn't to like impose our will on patients. Our job is to educate. Right? Offer options, educate the patients. If the patient says, yeah, I get it. I know my risks. I know my benefits. You know, I hear you loud and clear. I get what you're saying. Okay. Like the rest is on them. If they want to choose to, you know, get the fibroids taken out, take out the fibroids, right? That's our job. Our job is not to dictate. It's to educate. And you should know enough to be able to educate the patients on what's good and what's bad and hopefully be convincing. But if the patient's not convinced, you can't just turn around and say, well, I'm not doing it. That's absurd. 9 o'clock, baby.
Hello, doctors.
Okay.
I have to read that. Because it's plural.
Anything else?
Yeah, there's a little bit more to it, but I like the first part of the question a lot. Is it okay to do a saline solid hysterectomy after doing fertility testing and treating
Yes.
with antibiotics when preparing for an embryo transfer?
Yeah, as long as everything's sterile, it's fine. And someone who is Sarah Lynn said, well, Tarek, you basically are a doctor now.
Sarah Lynn is my new best friend as well.
She's your new best
Welcome to
friend.
the show. She has priority on questions.
There you go. All right, so I do think there's probably some upcoming articles that we will be sharing with you guys. I'll probably do one on low dose naltrexone since there's zero evidence that it works. So I think that would be good. And then we'll go from there. One last one from Mina. Dr. V, when do you get excited for your patients who become pregnant with FET? Is it the 12-week mark? Excited? I get excited the minute I find out they're pregnant. Have a great night, guys. We love you all. And